Hey, it's Dr. Allen here, Develop Chiropractic. I got Dr. Shelby here with me. We're going to be going over how to use the massage gun on your traps and upper back region. So when we're using this, I like to start with the round attachment. So basically we want a broad surface area, and then as we're working, we find a tender point or a trigger point. We can swap out that head for a little more direct access into the muscles. So when I start, we're going to do some scanning. So I'm going to turn this thing up to a high level. And we're going to start from the base of the skull down towards the tip of the shoulder. Now in the shoulder blade region, you got to watch out for about a finger's width bone that sticks out right here called the spine of your scapula. And then we're going to watch out for the angle right about here. Again, when you find these structures, it's going to kind of vibrate weird and the machine's going to start bouncing a little bit. So you'll know when you're on it, or they might slap you and let you know that you went a little too deep. Hopefully I don't get slapped, so here we go. Nice and easy. Now when you're doing this, you're just letting the machine do the work. I'm not pushing very deep into it. I'm going to work kind of a V shape from the right below the ear down towards the shoulder. And right when I get about here is where the bones start. So I got to watch out for that region there. And then it's kind of a V shape down. There's the scapula right there. I'm going to work down between the spine and the scapula. So just warming the area up, doing a nice V shape. We'll do maybe like, 5 passes or so, just getting everything warmed up. And what I'm trying to feel for as the person using the machine is I can feel a little bit of like a density in the tissue. As you work with these tools a little bit, you'll be able to kind of feel with them a little bit where the areas are. You'll kind of see their head shift a little bit when you find a tender point or a trigger point. And those are the areas we're going to focus in on when we do the smaller head piece here. So again, we're just doing kind of a V shape around the bone. Doing okay with that pressure?
Yep.
Awesome. Alright, so I've noticed right about here, she's got a little density increase and a little spot kind of a little bit higher up on the top of the shoulder. So I'm going to swap out this head for a smaller point. And when we're doing this, we're going to turn the speed down to about a medium-low setting. And again, we're just going to let the machine do the work. I'm not doing a lot of pressure with my hand on this one. When we have the smaller heads, these can be a little intense, so you got to be careful not to push too hard with these. Now I'm basically just resting the tool on her shoulder here. Now while we're here, I'm going to have her take a couple deep breaths. As she's breathing, we're going to engage that muscle that's deep, hooked onto the rib cage, right around that region, and that's going to help to kind of contract and relax the muscle as we're letting the vibration do its magic. You okay with that pressure?
Yep.
Okay. Yeah, so we're maybe spending 1 minute to 2 minutes on this point. We're going to come out a little further, right on top of the shoulder, right through here. Now while I'm on this point, we could actually create some internal tension. I can have Dr. Shelby rotate her head away. She can kind of tuck her chin down, and that's going to start to stretch this tissue that we're on right here. And just kind of going back and forth between those movements will move the tissue underneath the contact and help to separate those fibers a little bit better. Awesome. Let's do one more. Good. And I think I felt one more right about there. Now if we're kind of between the shoulder blade and the spine, what we can have her do is take this hand, and you're going to rest her hand on the opposite shoulder. So what that does is it swings the shoulder blade up and out the way. Now I can access some of those deeper muscles that attach to the rib cage there. She's got a nice little point right there. You okay with that pressure?
Yep. Okay,
now when we're here, we're just going to take a big breath in. We're just more trying to move the ribs with the muscles more than anything. Good. And sometimes when you're on a point, you can see the body start to twitch a little bit. That's a very classic characteristic of a trigger point. So it means you're on the right point, just back off a little bit so the body's not twitching at you. Hoo-wee. And again, I'm barely using any pressure, and you feel that pretty well, right?
Oh yeah.
Yeah. So I think a big problem a lot of people do with these massage guns is they try to dig in and push until the machine's like going crazy vibration. But you actually get a better result, a better release of the tissue when you just use a light pressure and let the machine do the work. All right, go ahead and relax that arm down. So that's a pretty good introduction to how to work the neck, upper trap region. Pretty basic stuff. Just watch out for the bone. Again, you got the scapula in this area, you have your spine, and then you have the spine of the scapula, which is kind of like a finger-shaped strip of bone right through here. Hopefully this helps. If you have any questions, feel free to reach me here at the office. Be safe, have fun, get at it. See you soon.